Doctors, what's one time your patient gave you medical advice? I was a resident in my final year, running on 3 hours of sleep and too much coffee. It was February, middle of flu season, and the ER was slammed. I'd been on shift for 13 hours straight when they wheeled in Mrs. Sylvie Morales, 74 years old, clutching her stomach and throwing up into a basin. I grabbed her chart. Severe abdominal pain, vomiting for 6 hours, no fever. I ordered the usual tests. Blood work, CT scan, the whole routine. Everything came back normal. Liver fine, kidneys fine, no blockages, no inflammation. Textbook case of bad food or a stomach bug. I walked back into her room, ready to send her home with anti-nausea meds and instructions to drink fluids. Mrs. Morales, your tests look good. I think you ate something that didn't agree with you. We'll get you some medicine and— No, she interrupted, gripping the bed rail. This is different. I'd heard that before. Everyone thinks their pain is special. I understand it feels severe, but doctor, listen to me. Her voice was firm now. You're thinking about what I ate yesterday. You need to think about what happened 30 years ago. That stopped me. What do you mean? I had my gallbladder removed in 1994. The surgeon nicked something during the operation. They fixed it, but every few years since then, I get this exact pain. It's scar tissue pressing on something inside. I don't know the medical name, but if you look at the old surgery notes, you'll find it. I almost walked out. Almost told her that was impossible, that our scans would have caught it. But something in her eyes made me pause. She wasn't panicking or being dramatic. She was dead certain. Do you remember which hospital? St. Vincent's. But it closed in 2003. Great. I went to the nurse's station and started digging. Called medical records, got transferred 4 times, finally reached some guy in archives who'd worked there decades ago. He found a physical file in storage and read it to me over the phone. There it was. Complications during cholecystectomy. Possible adhesion formation noted. Patient advised to monitor for future symptoms. I went back and ordered a specialized MRI with contrast, the kind we usually skip because insurance fights us on it. 2 hours later, the images came back. Her intestine was twisted up in scar tissue, cutting off blood flow. Another few hours and part of her bowel would have died. She needed emergency surgery. I called the attending. He came down, looked at the scans, and immediately took her to the OR. The surgery took 90 minutes. They cut away the adhesions and untwisted everything. She'd be fine. The next morning, my attending pulled me aside in the hallway. Good catch on the Morales case. That kind of clinical thinking is what separates decent doctors from great ones. I shook my head. I didn't catch it. She told me exactly what was wrong. I just finally listened. He laughed. Well, that's still a skill. Mrs. Morales went home 4 days later. Before she left, she grabbed my hand. Trust your patients, doctor. We live in these bodies. Sometimes we know them better than any machine.